Hi, everybody, and welcome to the first ever episode of Hanging with the Hero. I am Dave Azer, and I am so excited that you are joining me for this show. The goal here is to highlight incredible Americans doing courageous, inspirational, wonderful work around the country. And our first guest on our first show, I'm so excited to welcome Luca Pietro. He's the owner of Tarralluci Vino. It is a restaurant group in New York City, and he's the founder, along with his daughter, of Feed The Frontlines New York City, a wonderful organization that helps feed doctors and nurses and healthcare workers in the city who are working overtime because of COVID-19. So Luca, thank you so much for being our first guest.
I'm very excited to be here, Dave. Thank you for having me.
We have so much to talk about. I'm so excited to get a chance to chat with you. The first thing I want to ask you is I'm broadcasting from here in South Florida. Obviously, we all know New York City has been hit the hardest. It's the epicenter of everything that's going on. How are things now? Any semblance of returning to any sort of normalcy these days?
Well, it depends on who you ask and which hospital you go to. The city has been hit, very hard, but some areas have been hit harder than others. So when we go and do deliveries of our meals up to some areas in the Bronx, they're still in emergency mode, and it's very, very tough. You still have ambulances lining up, waiting to, fortunately, bring people in. We have the same in some hospitals in Brooklyn. In Manhattan, I feel like things are under control. Doesn't mean that the emergency is over, but things are under control. And but it's still very hard. I think that some people are saying we are at the peak, but the peak will have maybe a very long tail, and we're going to be in a plateau for a while. We don't know. We just don't know. It's still quite difficult.
Sure. Of course, all of us all over the country are experiencing different versions of this. We are certainly all in this together. And it's especially wonderful that you're able to do what you're doing in New York City. And we're going to get to Feed the Frontlines in a moment. But first, I just want to go back in time about a month ago, really, where Mayor de Blasio essentially ordered all of the restaurants in New York City to close. Now, you have 5 restaurants in and around the city. So take me back to that time for you. Not only are you worried about your health and your family's health, but now your business. What was that time like for you?
Well, I remember very well just the days coming up to the announcement where we had to shut down. And we had already had to reduce our capacity by 50%. And then on Sunday, March 15th, the order came that restaurants had to close except for takeout and delivery. So there was I cannot say that I didn't see it coming, because I saw what was happening to my family and to my friends in Italy, but it was still quite shocking, and it was just unbelievable to have and be a reality. So the morning after the shutdown, I had to decide what to do, and I basically, within one day, I had to close 4 out of my 5 restaurants, and had to furlough, let go 95 people. So it was just awful, because these are people that have been with me. Some of them have been with me for 15 years. So it's a small business is yes, it's a business, but also it's an extended family. So when you have to make some choices like that, it's really hard. It's really heart-wrenching, and it was painful.
And then from there, as I understand it, you get a phone call from a friend in Canada who has an idea to help you and also to help some of the hospital staff around the city, and everything changes. Take me through that.
Yeah, well, as the news of the shutdown of New York's restaurants came, some friends reached out, and especially one, Robert, my friend from Toronto, and she said, it's so terrible what's happening. I would love to help you. Can I buy some meals that you can then deliver to to people on the front lines, in emergency rooms, so forth. And I said, of course, sure. And she said, what would you recommend? And I said, well, I don't have great recommendations as far as ER are concerned, but, we spent time at one of the main city hospitals many years ago when my son was not well. And so I said, you should check out NYU Langone, which is one of the main hospitals. And she made contact with the ER department and called me back about 2 days later and say, hey, I have an order for you for 40 people at DR at NYU Langone. And can you deliver tonight at 7 p.m.? And now, of course, I said, this is amazing and this is so helpful. And of course I want to do that. And we did it. We did, we delivered 40 meals that night.
And what was the reaction? Because we can only imagine, if we don't work in that industry, in the healthcare industry, if we're not on the front lines, how exhausted those people are and how scared they are. Not only are they saving lives, but they're also worried about their own health, obviously. So the smallest gesture, great food, I mean, it lifts everybody's spirits. What was the reaction when you brought the meals?
Yeah, I think that when you are not in that, as you were saying, if you're not in that world, you don't understand. And I've, in the month since we started this initiative, I've learned a lot. But, going back to that day, we basically delivered curbside, and we had 4 people working in the ER come out, and they were all smiles, and their eyes brightened up, and they were saying, hey, we're so happy for you to bring this food. We're getting very busy, and we don't have time to buy and really look inside in taking care of patients. So they were surprised. We're very happy to see that.
And then from there, the business takes off. Talk to me. So you do that, you have that great experience. Now talk to me about the next phase where you take a step back and you say, okay, I'm on to something. Not only can I do my part to help the community, but what's also wonderful about this, Luca, is you've been able to keep some members of your staff employed because somebody's got to make all the meals. Okay, so do we have you back? We just lost you for a second.
Yeah. So what happened after that was that, they were basically I didn't realize seeing the joy that those simple meals brought to them. Isabella, we still have, sorry about that.
That's okay. Listen, this is going on. If you watch the major networks around the country, this happens to all of them, CNN, Fox News. So we're all going through the technical problems together. No problem. And by the way, since you just mentioned Isabella, we should, and we see her walking around the set there, we should give her massive props because she's heavily involved in this operation, isn't she?
Oh, absolutely. Absolutely. She is, she's working so hard, trying to triage all the demand from various hospitals throughout the city, coming in and asking for meals, and we're trying our best to get it all squared away. But I wanted to go back to that first night. That evening, I was talking to Isabella and my parent and my wife and my other son, and I was saying, we are, I'm thinking that these people need so much help, and wouldn't it be great if we could help them, and while helping them, helping ourselves, helping our staff, and hopefully bring someone back. So I circulated this idea among some friends, and one of them popped up right away, and they said, hey, come in for the next 50 meals. I would love to help. And sure enough, we connected another ER for NYU in Brooklyn, and they asked for 50 meals. And following night, we delivered 50 meals paid by our friend and customer and fellow soccer player. So we, so that, and we were talking and say, no, this might be a good thing. And Isabella, with a friend, Isabella was just back from college. She's a senior, and but she had to, come back as every college student in the country. She put together a website within 18 hours, which was just incredible. And you've seen the website.
Yes, it's great. It's robust. It's terrific.
Yeah, and so these kids are amazing. So we launched the website on the 21st of March, and the first day we launched it, or I will never forget this. We launched it at 11 a.m. and by 8 p.m. we had received $12,000 in contributions, which is incredible. I think that people just wanted to help us. These were mostly our customers and our friends, and also they wanted to help people on the front lines. So, it has been just an incredible ride. We've, from the first 50 meals, we our partner restaurants talking about meals.
We're having some more connectivity problems, and I apologize. I didn't hear the end of what you said. Did you get to the big number that we were talking about before this interview started? Is that what you said? Say it again.
Yeah. Well, basically, since we started with 50, we kept on growing, and we are now, we have brought on, we reopened a second kitchen. We brought on brought back, and we have gotten the help of 5 other restaurants. We have 8 restaurants that have come to help, and so we are about 15 restaurants, and we are delivering about 2,500 meals a day now. So it's been incredible.
It's really unbelievable, and I'm just so proud of you and your family and all these other restaurants. I'm from New York. I grew up in New York, and I've lived in a handful of places, and maybe more than anywhere else. New York, I think a lot of times gets a bad rap, and people are tough, and people can be in their own business, but also people come together. And people are coming together all over the country, not just New York. Of course, I understand that. But I do think there is that spirit in New York. When faced with adversity, people really come together, and certainly more than any other city in America, your city has taken a lot of lumps from COVID-19. So I'm guessing it must feel good for you, for your family, for these other restaurants to be able to be part of this community that's doing your part to turn some frowns into smiles, right?
Yeah. One second again here.
Yeah. While you, that's okay. While you work on that, let me reset quickly in case people are just tuning in now. Give you a second to iron out those issues. It's totally fine. If you are just tuning in now, thank you. Welcome to our show. It's the first ever episode of Hanging with the Hero. My guest is Luca di Pietro. He's the owner of Tarralluci e Vino. It's a restaurant group in New York City with 5 restaurants. And he's also the founder, along with his daughter Isabella, of Feed The Frontlines New York City, this incredible organization that we've been talking about that essentially supplies meals to doctors and nurses and members of the medical communities on the front lines, working extra hard, saving lives these days. And I want to talk now, Luca, a bit about, and we'll come back, we'll mention this again at the end, but I do want to mention it now because you're saying so many great things about community involvement. If people watching right now want to donate money, want to help you provide meals, where's the website? Where should we send them?
Yeah, it's the website is feedthefrontlines NYC.org, and we have had an impressive. We are overwhelmed by the generosity of our friends, our customers, and New Yorkers and Americans at large. We have received all sorts of contributions. We received $2 contribution from a child from Oklahoma. We've gotten, incredible notes, and we're overwhelmed. We're overwhelmed by generosity.
And you can customize this, right? You can choose which hospital you want the food to go to. And also members of the hospitals can get on the website too and place orders, correct?
Yes, we have different levels of contributions, but what has been happening as we have expanded, member of the medical professionals have the chance of requesting meals, and what we do is we try to get to them as many times and as quickly as we can. We are we are tied or bound by how many donations we receive, but we try to spread the wealth as much as we can. I don't know if I told you, Dave, but we have gone to 26 different hospitals around New York City.
It's amazing. It's really wonderful. And I have eaten my fair share of hospital food. No disrespect to hospital food, but it's not great. Tell me about some of these meals. Where do you make it?
Well, we've tried to keep it interesting. So we have different things, but we have pastas. We have pasta with vegetable pasta or with bolognese sauce. But we have a very good lasagna, and then we have salmon with farro. We have great chicken with roasted potatoes. We have very good sandwiches. We make our own bread. We have good good quality ingredients. So we try. I talk to now hospital workers, but also hospital administrators and ER administrators. And they say, we need the nourishment, and they are working so hard. Sometimes 12 hours.
They really are going above and beyond. Yeah. Okay, so, I think you've frozen again.
Yeah, we're
you're back.
Our Wi-Fi is maybe a little bit sketchy.
It's okay. It's fine. Again, this is the new normal for everybody. I would love to ask about you personally. We mentioned this in the beginning of the conversation. Are you there?
I'm good now.
Okay, yes. Yeah. So we mentioned this in the beginning of the conversation, but I want to go back to it. You never thought, how could you have thought that this was going to be your life a few months ago? You never could have imagined that you would now have reinvented yourself. But for you, present day, now looking back on a month ago when the restaurant shut down, and months before that when you were just a restaurateur going about New York City, I mean, your personal life has changed so much. Have you had time to catch your breath? I know how busy you are. Have you had time to stop and just take a look around and say to yourself, this is what I'm doing now. This is my new reality. I can't believe how different it is from what it was like just a few months ago.
Yeah, I think that, it has been very hard to stop and think. We're up relatively early in the morning and we don't go to bed until quite late at night. So it's hard because we're managing so many people and so many things, so many restaurants and so much demand that I haven't been able to really stop and reflect. But what I, that day when I had to let go 95 people, it was, even though I knew rationally that was not my fault, but I still felt it was my fault. I thought of the people that have been with me for many years, and some of them, the restaurant industry is tough for workers in the restaurant industry and for the owners in very low margins, and so it really broke my heart. So I always thought, hey, I gotta stand up and figure something out so that I can keep my people employed, fed, and they can take care of their families.
And I asked you earlier how the hospital workers felt when you brought food to them. How do your employees feel, the ones that you've been able to keep on? Have they said anything to you? I can only imagine how grateful they are.
Well, my employees have been, I think they were shocked when I called them back. When I called many of them back, he was like, hey, I think maybe some of them felt that I had lost my mind. And I think that they've all been so busy that they are, the restaurant people are tough people. They're not gonna, hug and kiss, especially in these times. But
Right.
but they're grateful. They're happy. They're happy to be working, and they're happy to be doing something that is bigger than themselves. Because they see the news. Everybody sees the news. Many of my workers live in the hardest hit areas, the Bronx or near Helmers Hospital in Queens. So they know, they see, and they have people impacted by this. So they are helping. They're helping in this, and they're lending a hand, and they're getting paid for it, which is important. So they're happy. They're happy to be here.
That's great. That's great. I have a question that's a slight bit off topic, but not really. But it's affecting all of us. We're ordering in, we're picking up, curbside, things like that, and I think many of us are overly cautious about wiping stuff down and not bringing food in if it's in a box. And I'd love to get your professional opinion or your professional expertise for any of us who pick up food from our favorite restaurant or we have it delivered to us. Can you just talk us through, you're not a doctor, I understand that, but some of the health steps that we should go through, how diligent do we have to be with regard to making sure the preparation of the food is clean and things like that? Any advice you could give would be great.
Well, what concerns restaurants, we are in New York City, which is one of the toughest enforcement in terms of health, the health department, and they have inspectors that visit restaurants, once or twice a year. So all the rules that you hear about now, we already follow. Every restaurant, any professional kitchen would use the same rules that we are told we need to follow now, because nothing has changed. Wash your hands for 20 seconds, cover your hair. Do not touch anything with your bare hands. If you touch anything with your bare hands, that food must be reheated above 165 degrees. It's if you make, we make our own bread, so of course we make it with our hands, but then you cook it, so that eliminates any kind of parasites or anything like that. So we are following Department of Health's instructions, and I think anyone, at home, it's very important not to leave, use different cutting boards. If you're cutting chicken, please don't just remove the chicken and put bread. These are all things.
We lost you there during some of the most valuable advice. We lost you for a second during the cutting board.
No, Dave, but it is important, because we forget, you don't want to have cross contamination.
Right.
You want to make sure that you work clean, both at home and in the restaurant kitchen. I freak out sometimes with my kids and my wife, I should say too, at home, because you want to make sure that if you have something that is uncooked, you want to keep it separate from what is cooked. If you have a fridge, don't put fresh meat on top. Put it on the bottom, and put stuff that is dry on top. So all these things are nothing new for people in the restaurant business, but I understand that we need to observe these rules, and we do this. We're extremely careful, and we are even more careful now, especially during these very hard times.
Sure.
But right.
Yeah. And the last thing I'd love to ask you is what advice you would have for anybody watching who wants to do something in their community, whatever it is, whatever their area of expertise is, they want to get involved. You have done something wonderful. You every day are continuing to do something wonderful, and you are an inspiration. So if you could just inspire some of our viewers right now, what would you tell them?
I think, one second. Okay, you have me.
I got you. You were building up the drama. It was perfect.
Okay, now we have, it's, you built up the drama.
Right, exactly.
Well, I do believe that in life, we all have to something in a situation like this. I think we have to refresh.
It's okay. While you work on that, let me just once again welcome everybody to our show, Hanging with a Hero. This is the first episode we've ever had, and our guest today has been Luca Di Pietro, the owner of Tarralluci, a Vino. It's a restaurant group in New York City. He's also the founder of Feed The Frontlines New York City with his daughter, Isabella. We've spent the better part of the past half an hour chatting with him and his incredible initiative, Feed The Frontlines. And if you missed any of it, I'm going to re-air it on Facebook, and then I'm going to post it, and I'll have a link so you'll be able to catch it on YouTube, on my website, anywhere you want to go. It's certainly worth watching. Here's a guy who, as of 6 weeks ago, was operating 5 very successful restaurants in New York City. And then about a month ago, because of the order of the mayor, Bill de Blasio, unfortunately, he had to shut the restaurants down. But he then came up with an idea with some help from a friend or two and his daughter, Isabella. He came up with the idea to start Feed the Frontlines New York City, where basically he would get donations from people in the community and use that money to make meals for doctors and nurses and members of the medical community working overtime on the front lines in hospitals in New York City. And he has built this out to be this wonderful, incredible initiative. He's served over 25,000 meals. He serves over 20 hospitals in New York City. He's really done incredible things, and he is a huge inspiration. And we lost him technically, but I think he's coming back right now. There he is. I was just, you used that opportunity when you signed off. That was great because it gave me a chance to run down all of the amazing things that you have done. So I just spent the last 2 minutes telling everybody how great you are in case they missed it. So welcome back. And as we started to discuss, I'll ask you again, what advice might you have for anybody watching who wants to do something in their community to help in whatever way they can? What would you tell them?
Well, I think that we all need to find a purpose. We find a purpose in a time of crisis like this. Yesterday, we had someone who was walking around, Columbus Avenue, where one of my places is, and he had masks with him, and he knocked on the door and said, "Hey, do you guys need masks?" We were fine, we were well stocked, but this is just a resourceful gentleman who wanted to help out, and he had his own mask and gloves, and he just wanted to help that way. We had someone else who's preparing care packages for the homeless, and he asked us if we could provide some sandwiches, and he was getting toothpaste and socks and soap into this care package, and he said, "Oh, I want to do 50 a day," and so there are so many things that can be done, and I think that if we talk about food, and there is going to be so much food uncertainty, throughout the country, big cities, small cities, that if we can remove some of all the canned beans that we've stocked from here to eternity, and maybe start giving them out to people that really need them, that would be one way of doing a little bit.
And I think that's the point. It doesn't have to be some grand, huge gesture that requires a ton of infrastructure. It can just be a kindness, that you do for somebody else. And in your case, it started out as a kindness. It still is a kindness, but now it's on a much bigger scale. I am so grateful for you, for joining me here today. The first episode, the first guest, the first show. What a blast. Thank you, Luca, so much. And I want you to, one more time, just tell everybody how they can find you, how they can help. You can give social media, give a website, whatever you'd like.
Well, I'm going to bring my partner in crime here, my daughter Isabella, who deserves a shout out. She's been incredible. And Isabella can talk about all the social media handles and website, the stuff that I don't know about.
Yeah, well, sure. Well, thanks for having us, Dave, and for sharing what we've been up to here. The easiest way to get involved and to support the work that we're doing is to go to our website, which is feedthefrontlinesnyc.org. And we try as much as we can to post about what we're doing every day on social media. We show photos of the people we're serving, the food we're preparing, and you can follow us on Instagram at Feed The Frontlines, on Twitter at Feed The Front NYC, and we also have a Facebook page, which is Feed The Frontlines NYC. Really, if you can't contribute by buying a meal, you can help spread the word if you're interested in the work that we're doing.
Thank you both so much. And by the way, when you do go to their website, if you like the way the website looks, Isabella is the creative genius behind the website. She built it. So there you go. Just yet another way that the family is really doing some extraordinary work. Luca, Isabella, wonderful to see both of you, and congratulations on your endeavors, and best of luck. And we'll stay in touch for sure. Thank you so much for joining us.
Thank you,
Thanks,
guys.
Dave.
Thank you.
You got it. Thank you, everybody, for watching. This has been Hanging with a Hero. We'll have another new episode next Wednesday, and I will be in touch with details about the guest for that one, and we will see you all then. Thank you very much.